Today we discuss the AMA's position on summary suspension of medical privileges. A summary suspension of medical privileges is one of the most devastating events in a physician's career. It is reportable after 14 days and takes months or even years to reverse. The costs to a doctor's career and for legal fees are astonishing. Once a doctor wins, the remedies to make the doctor whole are rare and sometimes non-existent. The American Medical Association maintains a firm stance on the use of summary suspensions within healthcare organizations. Under its policy titled Principles for Incident-Based Peer Review and Disciplining, the AMA outlines strict guidelines to ensure that this extraordinary remedy is used judiciously and with respect for due process. The AMA rules very closely track the rules in most hospital and medical group bylaws and track state law as well. In theory, the AMA rules are fair and excellent policy. In practice, they are often ignored or followed to create the appearance of fairness, while all discretionary decisions are predetermined to be made against the target doctor. The AMA is clear in stating that summary suspension of clinical privileges should not be a routine administrative action. It is an extreme measure reserved exclusively for situations where a physician's continued practice presents an imminent danger to the health of any individual. This high threshold exists to protect the physician's career and reputation from unwarranted damage while maintaining the primary goal of patient safety. Despite these policies, in real life, just a few accusations against a doctor can trigger the summary suspension. MEC investigations are often guided by highly experienced attorneys, and once the process starts, it is very difficult to stop. If the MEC is out to get the doctor, the procedural protections will not stop them. The procedural safeguards that the AMA recommends are theoretically fair. Because of the severity of a suspension, the AMA insists on a structured and timely review process. In terms of who has the authority to suspend, the AMA says that the decision should be made by high-level medical leadership, such as the chief of staff, the chair or vice chair of the clinical department, or the medical executive committee. But these entities have their own business and political goals, and if a doctor is whistleblower or a business competitor, these titles do not ensure fairness. The AMA says that once a suspension is imposed, the MEC must meet to review the action as soon as possible. This meeting must occur within 14 days, or before a report is required to a state licensing agency, whichever period is shorter. The suspended physician must be invited to attend this MEC meeting and provide a statement regarding the issues under investigation. While this meeting does not replace a formal, fair hearing, it is a critical step in the immediate oversight of the suspension. However, this type of meeting is fraught with danger. If the doctor vigorously defends himself, this can be twisted and used against him. Many meetings end with the conclusion that the doctor's failure to admit fault shows that he is a danger to patients. So, asserting your rights to defend yourself against a false accusation is turned against you. Following the review, the MEC must promptly decide whether to modify, continue, or terminate the suspension. If the suspension is sustained, it must trigger formal fair hearing procedures. Again, in practice, the AMA rules work when the MEC investigation is done in good faith. In the many cases where the doctor is unfairly targeted, these guidelines are ignored or adhered to in form but not substance. Our medical lawyers do use these AMA guidelines in attacking summary suspensions, and a superior court judge reviewing MEC conduct may well rule in favor of the targeted physician if these guidelines are not adhered to. For physicians, a summary suspension can be a devastating event. The AMA's policy H375.965 serves as a vital framework to ensure that such actions are based on genuine risk, rather than administrative convenience or interpersonal conflict. By mandating swift reviews and protecting the right to a fair hearing, these principles aim to balance the safety of patients with the professional rights of doctors. If a summary suspension has been imposed or seems imminent, you should contact the physician lawyers at the law office of Daniel Horowitz. We are expert in defending doctors, and we move quickly and efficiently to protect you. Call us at 925-283-1863. That number again is 925-283-1863.